Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about postpartum vaginal birth recovery. Childbirth is such an amazing and empowering experience. But unfortunately, some women are left with some pretty unpleasant postpartum side effects. There's bleeding, sore nipples, crazy emotions, little sleep, and a sensitive VJ. However, by using the tips I will be giving in today's video, you can speed up your recovery and make the discomfort a little more manageable. Be sure to prioritize your mental health, nutrition, and sleep and use all of the postpartum resources that are available to you. Remember, part of taking care of your baby is taking care of yourself. You need to make it a priority to take care of your well-being after giving birth. By taking care of yourself, you will create a happy, healthy mom for baby, and directly enhance your baby's development. At the end of this video, you will understand what you can expect postpartum. You will get the best postpartum recovery tips for healing after a vaginal birth, and also some postpartum warning signs to look out for. This video will help you take care of yourself, so you can be the best mom for your baby. Postpartum recovery is different for everyone. All new moms should at least expect some bleeding and soreness. Here's a general guideline of what you can expect during your postpartum recovery. The postpartum period takes place in 3 phases. The initial phase, known as acute period, is within the first 6 to 12 hours postpartum. If you had a hospital vaginal birth, you will receive your postpartum care while at the hospital. The second phase, known as subacute postpartum period, is within 2 to 6 weeks. During this phase, your body is undergoing major changes in terms of recovery, hemodynamics, metabolism, and emotional status. This second phase is what I will focus on for the purpose of this video. The third phase, known as delayed postpartum period, can last up to 6 months. Changes during this phase are extremely gradual. So for the purpose of this video, I will focus on the second phase of postpartum care. At the end of this video, you will learn about possible postpartum conditions, what to do and how to handle them. Bleeding. Be sure to stock up on pads, as you can expect bleeding on and off for up to 6 weeks after giving birth. Trouble urinating and passing bowel movements. Your normal bodily functions may not come so normally the first few days postpartum. You might find it difficult to pee or find yourself lacking in bowel movements. Abdominal cramps. Be ready for the abdominal cramps to hit as your uterus contracts to help it reach back to its normal size. Backaches. The hormones that loosened your ligaments during pregnancy could still wreak havoc on your back postpartum. Not to mention, you'll be bending over to pick your baby up, change diapers, and breastfeed around the clock now. Nipple soreness. Some nipple soreness is common during those initial weeks of breastfeeding. However, if you're in extreme pain while nursing or still experiencing nipple pain after the first week or 2, be sure to meet with your midwife, pediatrician or certified lactation consultant as soon as possible to have your baby's latch evaluated. Perineal pain or swelling. Expect some swelling and discomfort throughout the entire perineal area following a vaginal birth, or even if you did any pushing at all before a C-section. If you had any tearing, the wound should take about 7 to 10 days to heal. You might find that area very sensitive for up to 6 weeks, or even more. Hemorrhoids. You may be left with hemorrhoids from all that pushing during labor and delivery. I know, like you didn't already have enough discomfort down there. Night sweats. Your body goes through a significant hormonal change after childbirth. As your progesterone and estrogen levels lower, your body temperature is more likely to change. You're also left over with all this extra fluid from pregnancy, and your body will try to get rid of it through sweat and urine. Fatigue. Blood loss that goes with having a baby can make your body tired. Not to mention, you're going to be up every 2 to 3 hours to feed your newborn baby. Emotional, baby blues are pretty common between 2 days and 2 weeks postpartum. You may find yourself crying at random. Sadness with baby blues is usually nothing extreme and will go away on its own without any kind of treatment. Now let's talk about how you're going to recover from this monumental task of bringing a beautiful, cute, adorable angel into the world. Here are tips to help you soothe all those aching body parts and have an optimal postpartum recovery. Vaginal birth. With vaginal birth, you are more likely to have a shorter, smoother and quicker postpartum recovery. You will also experience a natural high oxytocin and be able to be up and walking shortly after giving birth. Please note, even if you're done bleeding, you still have an open wound inside of you where your placenta was. The chance for infection is extremely high during this period and just not worth the risk of resuming intercourse immediately. Even if you still don't feel like doing the do when the 6-week mark hits, don't feel bad. It's a big adjustment and can certainly be scary. Plus, you and your partner may just be too exhausted anyways. And, not to mention, breastfeeding can lower your libido. Stock up on hospital freebies. If you're having a hospital birth, be sure to stock up on all your postpartum needs that they offer. Anything that is already open, you're paying for anyways, so be sure to take them home with you. So, go ahead and grab the huge pads, PERIBOTTLE, Witch Hazel pads, and those awesome mesh undies. Witch Hazel is your friend. Seriously, this is a total lifesaver. They help with pain, itching, hemorrhoids, and swelling, and have such a soothing cooling effect. Simply place 2 to 3 in a row on top of your pad with each bathroom visit for those first few days or week postpartum. Painkillers, spray, and ice packs or padsicles. Your vaginal area is going to be pretty swollen and tender during the first 24 to 48 hours after giving birth. Help minimize your discomfort with ice packs, or make some DIY padsicles. Trust me, they are amazing. All you need to do is grab some heavy flow pads, slather on some aloe vera and alcohol-free witch hazel, wrap them back up, and store them in the freezer in a gallon-sized Ziploc baggie. Use these throughout the first week postpartum. They will make everything down there feel so much better. Plus, they reduce swelling and speed up healing. You can make them and keep in your freezer before going into labor and use as soon as you get home. Use the PERIBOTTLE. Fill your PERIBOTTLE with warm water and use it to rinse off your perineal area after going to the bathroom. This will help prevent infection and be much more gentle on your private parts than wiping. Tap dry instead of wiping. You don't want to add more irritation to the already irritated area. Using the PERIBOTTLE also helps decrease any burning and stinging you may have while urinating. DIY PERIBOTTLE. Get a new water bottle, poke about 3 tiny holes on the cover. Voila, you got yourself a homemade PERIBOTTLE. Sitz baths. Sitz baths is another great postpartum recovery tip. It not only helps cleanse the perineum, but it relieves itching, irritation, and minor pain. In addition, the warm water used along the sitz baths help increase blood flow to the perineal area, which can promote faster healing. Making a sitz bath part of your postpartum care routine is essential to faster postpartum healing. Sitz bath instructions. Fill the tub with 3 to 4 inches of warm water. Make sure the tub is clean. Add generous amount of salt. Soak for a few minutes, 15 to 20 minutes. Tap dry. If you are using the sitz bath kit or if you are using a big bowl, follow the same process. The difference is that you will be soaking your perineal area in a basin placed in your toilet seat instead of the tub. You can repeat this process 2 to 3 times a day as needed. After the sitz bath, tap your perineum, don't wipe. This might seem like an obvious postpartum care tip, but you'll be surprised as to how easy it is to forget it. When we use the toilet, we might do things on autopilot. That is why it is important to remember to tap the perineal area instead of wiping it in the first few days of postpartum. Kegel exercise. Kegel help get circulation going and speed up healing in the perineum. Kegel are also vital if you don't want pee to leak a little every time you laugh or sneeze for the rest of your life. If you're still having urinary and fecal incontinence after a few months postpartum, I strongly recommend pelvic physical therapy. As if all the above weren't enough to deal with, postpartum incontinence can also be an issue. But, don't worry. There is something you can do to help with that. Kegel exercises can help strengthen your pelvic floor muscles and help with incontinence after birth. So, what is a Kegel exercise? Think for a second if you really have to pee but have to hold it instead. The contraction that happens in our efforts to hold the urine in place is called Kegel. We tend to do this contraction on demand, but we can also do it voluntarily to increase the strength and endurance of our pelvic floor muscles. Postpartum Kegel exercise instructions. Gently tighten and then relax the muscles of your perineum. You can do this while lying down or sitting. Start with 2 to 3 seconds per tightening, then 5 to 10 seconds. End by holding your contraction for 20 seconds. Begin with 2 to 3 contractions per session and build up to holding 5 contractions several times per day. Positioning when you poop and pee. Peeing and pooping postpartum can be scary, but it certainly doesn't have to be. It's actually all about position. If urinating is painful, then try leaning way forward when you pee. I know it sounds weird, but it truly does help tremendously. If you're having trouble pooping, then try taking some stool softeners. Stool softeners will also make pooping a lot less scary. You can try to go the natural route and stick with prune juice. You could go the conventional route, if needed, and try some Dulcolax or Colace. Always seek medical guidance before usage. Breastfeed if you can. Breastfeeding also helps speed up postpartum recovery, as it helps shrink your uterus back down to its normal size much more quickly than if you were to formula feed. Breastfeeding also decreases your risk for postpartum depression, helps prevent breast and uterine cancer, and can even help you lose the baby weight. Breastfeeding is natural, but that doesn't mean it comes easy. Your nipples will probably be a little sore while you and your baby try and figure this whole breastfeeding thing out. Apply some coconut oil or nipple butter and use cold Soothes gel pads to help ease the pain. You can also expect your milk to come in full force anywhere from 2 to 7 days postpartum. When this happens, you're probably going to experience some engorgement. Lay cold washcloths on your breasts and pump for just a minute or two to get some relief. Postpartum breast care. During postpartum, breast discomfort, engorgement, and even pain can also prove to be quite a challenge. If you opt to breastfeed, the first few days or weeks your body will start producing more and more milk to meet the demands of your growing baby. Until your body starts to regulate the supply your baby needs, you might feel your breast full, warm, achy, and even tingly during letdown as your baby sucks. Postpartum breast care instructions. Take a warm shower and slowly massage your breast to hand express excess milk. After the shower, feed baby or pump to decompress breasts. Apply cold compresses to your breasts after feeding for 10 minutes at a time. Cold can reduce swelling and inflammation. You can still experience some of these symptoms if you aren't breastfeeding. Therefore, applying the same techniques will also help. If your breasts become extremely engorged, painful, you are unable to feed baby, and/or you develop a fever, contact your midwife or doctor. Postpartum belly care. A loose and achy belly is one of the most noticeable postpartum body changes. Using a postpartum belly bands helps keep things in place as your belly shrinks back to size. They also aid with postpartum discomfort, swelling, and circulation by means of compression. They help restore your body shape, retrain your abdominal muscles, and relieve postpartum back pain. It will help trim down your waistline and bring back the confidence you need postpartum. Good postpartum nutrition. After giving birth, your body undergoes many changes. It is vital that healthy and nutritious foods form part of your postpartum care plan. Eating colorful produce, healthy proteins, fats, and certain grains will provide you energy, help you combat anemia and hasten wound healing. Good nutrition will also help keep your emotional health in check and help fight fatigue. It even aids in strengthening your hair, protecting against postpartum hair loss. Here are a few examples: green leafy vegetables such as spinach, kale, broccoli, vitamin C packed fruits such as berries, citrus fruits, kiwi, and pineapples. Healthy proteins such as organic eggs, organic chicken, grass-fed beef and wild salmon. Whole and sprouted grains such as rice, quinoa, oats. Nuts and seeds such as almonds, walnuts, flax seeds, pumpkin seeds, Brazil nuts. Healthy oils such as olive and coconut. Legumes such as black beans and chickpeas. Some women continue taking their prenatal vitamins for a few weeks postpartum as additional supplement, especially if they will be breastfeeding. Postnatal vitamins. Now more than ever your body needs all the help it can get. You can continue to take the prenatals you were taking while you were pregnant, or opt for postnatal vitamins created specifically for your postpartum and lactation needs. Walk it out. It is important to note that although exercise might be off limits for the first few weeks postpartum, being active is important. Walking postpartum can help prevent clots from forming, particularly if you had a C-section. Walking can also help ease and prevent constipation and guard against baby blues. Light exercise will also help reduce your pain, fight fatigue, improve your posture, and regain muscle memory. It can even help heal diastasis recti. Postpartum walkout instructions. Walk around your neighborhood. Walk around the house. Stay hydrated. Your body loses a significant amount of fluid after birth and the first few days of your postpartum recovery. More so, if you will be breastfeeding your newborn. It is extremely important to stay hydrated as it will help speed postpartum healing, breast milk production, and improve overall body health and well-being. Hydration instructions. Always carry with you a water container. Limit your intake of caffeinated and sugary drink. Opt for water, fruit or veggie smoothies, and broths, as your main source of hydration. Postpartum emotional care. Postpartum comes with a whole array of emotions. The birth of new child, caring for a newborn, hormonal changes, sleep deprivation, and straight-up exhaustion can send you into an emotional spiral. Although it is completely normal to experience changes in your mood, feel emotional, and feel tired, it is extremely important to learn how to identify possible signs of postpartum depression. Baby blues. Baby blues are very common. The baby blues are characterized by bursts of anxiousness and feeling down. They might also be accompanied by some crying spells and a few mood swings amongst other symptoms. Normally, baby blues last about 2 to 3 weeks after birth and start to subside thereafter. During this time it is important to take good care of yourself and share what you are feeling with your spouse, loved ones, and your midwife or doctor. Things that can help with baby blues: getting more sleep, finding a little time for yourself, staying hydrated and well nourished, getting some fresh air. Note: if the symptoms continue or get worse, please seek medical guidance. Postpartum depression. With postpartum depression, the symptoms increase in severity. There are many symptoms associated with postpartum depression, but the most common signs and symptoms might include feeling sad, hopeless, or overwhelmed, crying spell, feeling overly worried or anxious, severe mood swings, oversleeping or the inability to sleep, feeling like harming yourself or your baby. Note: please pay close attention to your symptoms. Seek medical guidance about any symptoms or scary thoughts you might be having. Your health team will be able to find proper care and help you through this postpartum phase. Home with a newborn. Although not a physical or emotional postpartum condition, coming home with a newborn could prove to be very challenging to a lot of new moms or even master moms. If you don't know how to handle or successfully adjust to your new life with a newborn, it could potentially hinder your postpartum healing efforts. It is for that reason that you must include bringing home your baby as part of your postpartum care plan. Please note that not all circumstances are the same, and not all new moms will respond or react the same to their new life with new baby. In addition, the adjustment period to their new normal also varies from woman to woman. Here are a few suggestions that can make your life a lot easier in your first few days home with your newborn. Bringing home a baby care plan. Sleep when the baby sleeps. Minimize visitors. Ask for help. Meal prep, meal freeze, and/or batch cook. Dishes can wait. Give yourself grace and know that you just accomplished a strenuous and miraculous task. Accept and ask for help. Now is not the time to try to be superwoman. That entire first year is just plain hard, so don't be afraid to accept and ask for help. You're going to have to let go on how you like things, and learn to accept the way your hubby fills the dishwasher. Let your friends and family take care of the cooking, cleaning, and grocery shopping, so you can take care of yourself and bond with your baby. Hire a postpartum doula. If you don't have any friends or family available to help, then I strongly recommend hiring a postpartum doula. This is such a valuable resource even if you do have other help. A postpartum doula can help with meal prep, warming up your freezer meals, light cleaning, and entertaining your other kids. She can also provide you with local resources, shall you need it, such as a lactation consultant, a postpartum mommy group, or a therapist that is specialized in postpartum disorders. She can help you with basic newborn care and answer all your new mom questions as well. Limit visitors. Limiting visitors will give you and your baby the time you need to bond and establish a good breastfeeding relationship. I know a lot of people mean well, but sometimes visitors can just be more work and stress than helpful. Don't be afraid to kick people out or tell your family not to visit for a certain amount of time after giving birth. You need to recover, figure out this whole breastfeeding thing, and bond as a family. Wear loose clothing. Now's not the time to be sporting those killer leggings, mama. Recover as practical and comfortable as possible with loose sweatpants, a nursing bra or tank, and an oversized V-neck t-shirt. Robes work great as well. I also recommend having some loose, easy to slip on shoes, as your feet will become swollen as your body begins to expel all that extra fluid that was needed during pregnancy. They may even get bigger than they were while you were expecting. Sleep when you can. I know this one is tough, and everyone will tell you this, but seriously, sleep when you can. Sleep is essential to both our physical and emotional health. You may not always be able to sleep when the baby is sleeping, but do try to reprioritize your life in order to get that much needed sleep. Let the laundry go unfolded, don't try to have every meal be home cooked, get the groceries delivered, and hire out a cleaning service if you have the spare cash. Just get some sleep, mommy. Give yourself grace. Becoming a new mom is hard work, and not everything is going to be picture perfect. Try to set realistic expectations for yourself, and don't compare yourself or your baby to others. Your house is probably going to be a little messy, the laundry probably isn't going to get folded, and not all of your meals will be home cooked. You'll probably make some mistakes, and you probably won't enjoy every moment of motherhood. That's okay. The world will keep on turning. Your baby will still love you, and you'll still be a great mom. Know the warning signs. While the tips above will help you have a smooth postpartum recovery, that doesn't necessarily mean you're in the clear for postpartum complications. Your body goes through some major changes rapidly during those first few weeks, which can bring about some unwanted, and even dangerous, consequences. All moms should know the warning signs of these postpartum complications. Infection. Your body is more prone to bacterial growth and infection during those initial weeks postpartum. Common types of postpartum infections include mastitis, endometriosis, urinary tract infections, wounds, and perineal infections. If you're experiencing fever, chills, foul-smelling fluids, breathing problems, and/or frequent nausea and vomiting, be sure to seek medical guidance immediately. Blood clots. Passing small blood clots vaginally for the first week postpartum is pretty normal, but a blood clot inside one of your veins can lead to a stroke and be life-threatening. If you're experiencing pain, swelling, redness, or warmth in one leg, head to the nearest ER. Other signs of a dangerous clot include shortness of breath, dizziness or fainting, rapid heart rate, and chills. Postpartum preeclampsia. The risk of preeclampsia doesn't end at birth. You can develop postpartum preeclampsia up to 6 weeks after giving birth. Warning signs include blurred vision, headache that doesn't go away with medicine, swollen face and limbs, sudden weight gain, nausea and vomiting, and stomach pain near your ribs. Postpartum kidney stones. Our bodies become better equipped at absorbing calcium during pregnancy, which could leave us with postpartum kidney stones after your baby is born. If you're having extreme pain in your flank, nausea and/or vomiting, painful and frequent urination, or blood in your urine, it's likely that you're passing a kidney stone, and you should head to the nearest ER to get your pain controlled and prevent dehydration. Remember that postpartum recovery is a phase, and that it too shall pass. Also, because the postpartum recovery phase might look different to every mom, please remember to talk to your midwife or doctor about any questions or concerns. The most important thing to remember is that you must take care of yourself so that you can take care of your baby. Always remember, happy healthy mama, happy healthy baby. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.